Hello, my name is Priscilla Mendoza, and I will be doing SBAR on one of my patients for the first 40 hours. Okay, so I had a 2-month-old female who was coming in for difficulty breathing, fatigue during feedings, and a fever of 100 and congestion for 3 days. She was seen by her primary care provider and her respiratory panel was negative. The only thing her provider prescribed was Tylenol for the fever, but no other medications for anything as well. Mom says that she was born at 39 weeks via vaginal delivery, no complications. She has no significant medical history or surgical history, and she has been developing normally. Mom says that she hasn't had any exposures to anybody in the home, like nobody's been sick, nobody's been she doesn't really take the baby out much, so this is just from one day to the other. She is up to date with her vaccines, and she brought her in because she saw that her baby was having like a lot of trouble breathing, getting super tired while eating, so she brought her in. So upon assessment, we did see that she did have a lot of intercostal and subcostal retractions, which indicated she was working really hard to breathe. She was very fussy. She didn't want us to touch her. She was very I think it was she was very fussy because she wasn't able to get a lot of oxygenation as well. Her oxygen saturation was at a 90%, which is very concerning. She's supposed to be at 100, but she was not. She did sound very congested as well, and she did have like a lot of like crusting over her nose as well. She did have an elevated heart rate. It was secondary to the work of breathing and the discomfort. She also did have a fever as well. Once we saw her, the provider put in orders for a respiratory panel. We're just going to test for different type of viruses as well. We also told Mom that we were going to suction her because she did sound very congested. She did have the moquitos on her nose. She was working very hard to breathe as well. Her lung sounds sounded very kind of coarse. Mostly in the lower bilateral lobes as well. She did have a little bit of a cough as well. So we were able to suction the nose and the mouth. We were able to give Tylenol. We told Mom to not cover her with a blanket, and for Mom to not be hugging her too much because that could increase the temperature as well. We also told Mom to hold off on the feedings, to feed her, just to wait a little bit, maybe 20-30 minutes, and then after that time range, we would fluid challenge her to see if she was going to do well, since she was getting really tired while feeding. So we let the 20-30 minutes pass. We fluid challenged her, and and she ended up failing. Her oxygen saturation kept going down to 89, 85, 88. She was just fluctuating a lot. So we told her, Mom, we're going to have to hold off on the fluids for right now. And then the provider ordered to insert an IV to start getting fluids in her body, in her system. And later on, we got a call from the lab that said that she was positive for RSV as well. So we continued to suction her throughout the shift. Not the whole shift, but part of the shift. We continued to suction her. Her oxygen saturation was not improving. She was at an 89%, and then the provider decided to put her on 2 liters per minute nasal cannula for oxygen, just to get her, help her a little bit. After 30-40 minutes, she was still not satting very well. So the doctor put in an order for the respiratory therapist to do a high flow oxygenation. And her oxygen did increase and went all the way up to 95 when she was on the high flow. The provider also recommended that she be put in the PICU for continuous monitoring because she was having a lot of trouble breathing and she is now on a high flow. So we recommended continuous monitoring of the oxygen saturation, the heart rate, and the respiratory status because that could indicate she could be getting worse as well. She was transferred to the PICU. We also advised to keep hydration, pain relief, and to monitor the fever as well. We also advise that they provide teaching to the family of what RSV is and how to treat it at home when she goes home. So it's basically just like fluids, um, control the fever with Tylenol or Motrin or whatever was prescribed for her, keep the baby well hydrated, make sure that anybody who comes in contact with the baby washes their hands, that they wash their hands, that everything is good and clean for her. And that's it. That's my SBAR for the first 40 hours. Thank you.